You've probably seen this video floating around on social media.
We have an important message for all of you, especially if you live in a country that is right now facing the new coronavirus.
It features a woman from the Czech Republic. She explains that her country was able to slow down the spread of the coronavirus by making the wearing of masks outside mandatory. And it was recently amended to include a statement from Adam Vojtech, the country's Minister of Health, urging all governments to follow suit.
I recommend to all fellow ministers and governments to implement population-wide use of face masks, even homemade ones.
The video also features a number of relevant experts in favor of the #MasksForAll movement, who explain that the masks are not just for protection against the virus, but also prevent us from spreading it, as they capture droplets expelled by our coughs, sneezes, and even speech. Yet the World Health Organization has repeatedly advised that you should only wear a mask when taking care of someone who might be sick or if you're experiencing any symptoms. It also states that masks are only effective when used in combination with washing hands and sanitization. So it seems a little confusing, as there are experts that support mask wearing for all, yet the World Health Organization is adamant that we shouldn't wear them. And perhaps that's because of the mass shortage of medical-grade masks around the world. The World Health Organization has warned that the severe and mounting disruption to the global supply of personal protective equipment caused by rising demand, panic buying, hoarding and misuse is putting lives at risk from the new coronavirus and other infectious diseases. According to the US Department of Health and Human Services, health workers would require at least 3.5 billion masks a year to tackle the coronavirus. There's only around 1% of that stockpiled, and that's only the US. China accounts for 80% of the world's mask production. It's now currently ramped up production to more than 110 million masks a day. In East Asian countries such as Japan, South Korea, and China, mask wearing is a common practice. And that's because they've endured pandemics in the past and are more aware of what social measures are needed to curb their spread. While across Southeast Asia and South Asia, masks are more commonplace as a countermeasure against high pollution levels. Either way, more and more experts are encouraging governments to push their citizens to wear masks. And for the Czech Republic, enforcing laws for mandatory mask wearing might be a little easier, as it's much smaller than some of the other countries currently struggling with the pandemic, or those on the brink of dealing with severe outbreaks. It only has a population of some 10.7 million people, with a healthcare system that the EuroHealth Consumer Index found to be superior to those found in the UK, Spain, and Italy. The #MasksForAll video does address the shortage of masks and how social media influencers galvanize people to produce homemade masks that would be donated. The World Health Organization, on the other hand, has stood by its position. Dr. Maria van Kerkhove, an infectious disease epidemiologist for the World Health Organization, has said,
"The masks that we recommend are for people who are at home and who are sick, and for those individuals who are caring for those people who are at home that are sick."
And that
the world is facing a significant shortage of personal protective equipment for our frontline workers, including masks and gloves and gowns and face shields, and protecting our healthcare workers must be the top priority.
many governments have taken the World Health Organization's advice and discouraged their ordinary citizens from wearing masks. But as the pandemic continues to spread around the world, will they live to regret this decision?